2020, the year COVID-19 caused a global shutdown. But has the virus changed the British way of life for good?
I must give the British people a very simple instruction. You must stay at home.
Stay at home.
Protect our NHS.
And save lives.
Well, on this special daily podcast, I'm joined by some of our specialist correspondents to examine the UK journey so far. Let me introduce them. You know them all in the studio with me. We have our economics editor, Ed Conway, science correspondent, Thomas Moore, in the screen, Sky's political editor, Beth Rigby. She is, of course, in Westminster. Joining them, technology correspondent, Roland Manthorpe, in his car somewhere, who knows, on the road. And completing our panel, Sky's climate change correspondent, Lisa Holland, who's covered the crisis in care homes during the course of this pandemic. What a range of expertise we've got here. And let's start, Beth, with you and me, in actual fact. And that moment, as you and I stood outside, we were summoned to Downing Street, Monday, March the 23rd this year, and we heard Boris Johnson doing something unprecedented outside wartime, locking down the nation. You must stay home. And I remember that sense of kind of electricity going up the hairs on the back of your neck, standing on end. Just your thoughts.
Well, Dermot, it was an extraordinary moment, wasn't it? And 27 million people tuned in to that address by the Prime Minister. Do you remember he spoke in that message officially locking down the country? And I was thinking about it the other day because I went back to what the government said on March the 2nd when they put out their COVID plan. And at the time they said 1 in 5 of us might have to work from home, that the police might have to patrol the streets, and it all seemed quite frightening. And then with breakneck speed, 20 days or so later, the government had locked the country down, taking decisions, momentous decisions, on a daily basis that would affect our lives, our society, and of course then propping up the economy, basically underwriting the wages of 9.4 million workers. So the government, in such a short space of time, kind of moving in ways that we couldn't imagine. And it was just unbelievable, actually, to be experiencing it and to be reporting on it. And you, as you said, you kind of look back on what's happened, and I still have to pinch myself to believe that it really happened, because it just seems so extraordinary at the time, and looking back on it, it just seems so extraordinary now.
And that's the thing, isn't it, about when it happened, though. Roland, come in on this and the timing. We say March the 23rd, and talk about electricity coursing through the veins or the spine or whatever. It was that report from Imperial College that had come out, what, a week before, was it, that led to the lockdown. Before that point, we got the sense from the government that they were going for so-called herd immunity.
You know, for me, looking at this pandemic, it's been really strange to report on it. There have been times when I've been on air and I've heard the words coming out of my mouth, and while I've heard them, I've felt shocked, I've felt a little stunned. And one of those moments was immediately after Neil Ferguson, one of the key scientists advising the government, said at a select committee that if we had locked down a week earlier, just 7 days earlier, then half the lives that have been lost could have been saved.
Thinking of the spread, that period, the spread of lockdowns obviously started in China, and I suppose the rest of the world went, well, it's China, that's where it started, and the Chinese are able to do that. Then, I suppose, from the European point of view, it was Italy, in the north of Italy originally, but it still then came as a huge shock that the United Kingdom then did it, but did it, it appears, late.
I think certainly in the UK and probably Europe as a whole, there was a belief that this was something that wouldn't spread to Europe, that this was an Asian issue, it was a coronavirus, it wasn't flu. Everything had been set up. All the pandemic preparedness was for a flu strain emerging from that region and then spreading extremely rapidly. And I think that paralysed everything that followed. Everything was set up for a flu pandemic, not coronavirus. And you treat those very differently. You don't need to test and trace for flu. You don't need the large numbers of hospital beds, because people generally don't need that kind of care, certainly not ventilators. And I think that is where we went badly wrong in those early days, that we didn't accept that there could be a virus out there with a mortality rate 10 times higher that was going to affect Europe.
Lisa, just come in on this, and I do apologise. I cannot remember where you were in late February, early March, where you were reporting from.
So in mid-March, I had access to a care home in London. And for me, honestly, I just think you could absolutely see the writing on the wall that everything was going down in care homes at that stage. There was so much fear, for a start, amongst agency workers. And remember that a lot of care homes do have very regular staff, but a lot of other care homes don't have regular staff. And so they rely on agency people. So it's people who are not regular faces, people who are coming and going. So there was a lot of fear. Fear swept through a lot of care homes like wildfire. People were not showing up for work. They were understaffed. They were under pressure. And then, as of course we subsequently learned, they were overwhelmed by the fact that there was a dawning realization that they were lower down in the food chain. I think it's really sad, actually, as a sort of thought, looking back at it now, that they thought they were going to be under this big umbrella, that they would be getting the PPE.
And Ed, I just want to talk to you about the economic calculations that were made in terms of the timing of going into lockdown. The government were well aware at that point of the economic cost. Looking back at it now, there is a sense, isn't there, that they were reluctant to do it because of the potential hit.
I think they were to some extent aware of the cost, but, you know, you've got to remember that nothing like this has ever been tried before, you know, to lock down an economy. It just hadn't been done. And so, you know, lots of people were kind of scrambling around for some sort of indication of how much this would impact GDP or employment and all those things. And frankly, a lot of it was kind of stabs in the dark, you know, and that even goes for the Bank of England, the Office of Budget Responsibility, all these people, you know, who produced the big numbers. And you'll remember, you know, at the time, we were talking about the biggest hit to GDP, gross domestic product, since the 17th, 18th century, you know, to 1706 is one of the years that people were talking about. Now, these are kind of, you know, almost imponderable kind of statistics and scenarios. All they knew, I think, you know, within Whitehall was that to try to take you know, this massive chunk of the workforce out would just cause the system to potentially to not work. And the extent of how close that came to genuine catastrophe, I think it's something we're still kind of getting our heads around. You know, we all, or many of us, lived through the financial crisis, and we thought that was going to be the one moment of economic catastrophe where the cash machines would stop working and where the system would seize up. You know, we came very close to that this time around as well, and that's on top of the obvious enormous public health issues we're talking about.
Beth, just before we leave this opening subject, this opening category, I mean, we can't leave it without mentioning the Prime Minister himself ending up in intensive care, as he then subsequently told us, 50-50 at death's door.
Yes, on March the 27th, it was announced that he had contracted the virus, and he basically was holed up on his own in his flat in Downing Street. And he put a couple of videos out, and you could see kind of days in, there's a sort of point where do you recover or does your condition worsen? And I will never forget being at Downing Street on the night of April the 5th, and it was the Queen's address to the nation, and we were all there to talk about the Queen's address. And I remember coming back to the office, and about 9:15, this message landed in my inbox saying the Prime Minister had gone into hospital. Downing Street were kind of downplaying it, saying he was going in for tests, but I knew it was really serious because there was no way that the Prime Minister would have wanted to overshadow the Queen's address while she was rallying the nation. 24 hours later, I was in St James's Park actually going for a little walk between the 7 o'clock news and waiting to do the 10 o'clock news. And again, I got the message that he'd gone into intensive care. And I remember running back to College Green to go live and talk about it. And my heart really was in my mouth at that point because that was really frightening.
We've got a lot to discuss, so we're going to move on now to our next section, which is Care in Crisis.
The 21st century global pandemic requires an unprecedented response, and the NHS Nightingale is just that.
NHS staff are risking their own safety.
I understand people's anxieties on the front line.
I am now setting the goal of 100,000 tests per day. Testing is so important for getting Britain back on her feet.
What I say to the government is, open the books. We know there's been double counting. We know that some of the tests that have been sent out never made it back.
Up and down the country, relatives and care home workers are painting a picture of a sector which is in places close to collapse.
They want to discharge people, but they don't want to test.
Right from the start, we've tried to throw a protective ring around our care homes.
Well, let's examine that protective ring claim about all of care. And Thomas Morleese has been talking about it already. Again, a whole inquiry could be held into and will be held into what went on in care homes. But the clue, wasn't it, was in the slogans that they put together there. Stay home, protect the NHS, save lives. Now, of course, care homes aren't part of the NHS. They presumably have succeeded in protecting the NHS, but at what cost?
Dermot, the warning signs were there in the data coming out of China. We knew then that this was a disease that had a mortality rate of at least 1%. We knew that it affected the elderly. Why we didn't take an early step to protect care homes is just one of the greatest scandals of this epidemic here in the UK. We missed it completely, and we should have taken action much sooner. We didn't give the staff the PPE they needed to protect themselves and the people they were caring for. We discharged people from hospital when they needed to clear wards without testing, and there's almost certainly going to be a large number of people who went into vulnerable care homes with the infection, and it then spread very rapidly, and that has been something that we've been living with ever since. It is probably why we continue to have this long lag, this long tail to this epidemic, whereas other countries have got back to reopening their economies much sooner.
Lisa, I mean, you know this inside out. You've been reporting on this now throughout the crisis. And I just want to throw in, as you tell us what has been going on in the care homes, just take this on board as well. The fact that the Prime Minister said, well, some of the care homes weren't correctly following the procedures. Were they actually given any real and proper guidance?
On that day when Boris Johnson went he was in hospital and he went into intensive care. On that day, I broke the story about the concerns amongst care homes that they were being asked to take in people who were untested, so coronavirus patients who hadn't been given the all clear, and they were deeply, deeply alarmed about that. And in fact, Beth and I had discussed on that day that potentially she was going to raise that question at the daily briefing to ask the government about its guidelines, which care homes were saying added up to a suicide note. And of course, then, within a few hours, Boris Johnson went into intensive care, and the entire focus was on Boris Johnson's health, how do ventilators work. There was this national obsession with that's where the story was. And in fact, at that time, there were already massive alarm bells raised by care homes, and in particular about this policy, which I reported on that day, articulated by, I think we're going to hear a clip now from a man who I interviewed who ran a care home in Torquay, Graham Greenaway, and this is what he said about those guidelines.
That would be tantamount to importing death into care homes. The care homes have done all the right things against all the odds. To add insult to injury by asking us to take COVID-19 positive patients is asking us to basically make out the suicide note for people in care.
We surveyed them and said, do you think COVID patients being discharged to your care home caused the virus to spread in your nursing home? And nearly 40% said yes. And we also did stories about care homes who were told that if you don't take COVID patients that haven't been given the all clear, so therefore could still be bringing the virus with them, then they wouldn't get these so-called uplift payments to help them pay for the cost of dealing with coronavirus, so to pay for extra costs like PPE and the like. So they felt that they were really caught between a rock and a hard place.
Next up, as we reflect on the year so far, we're looking at scientists and the data.
There's a very high likelihood that come winter, we will see an increase in cases.
There's always a question of timing, and there's always a question of what do you do now, even in the middle of something, and be very clear, we are not at the end of this epidemic, not by a long shot. we're in the middle of it.
Had we introduced lockdown measures a week earlier, we would have reduced the final death toll by at least a half.
Well, Thomas, following the science, that's been one of the mantras. But as we've discovered, as you well knew before it all happened, was there's no such thing as the science. There is scientific opinion, and much of that conflicting, and it's up to the politicians then to decide on the policy.
Yeah, and I think there's been a big question here whether the science has been diverse enough, whether the SAGE committee, the key advisory committee that channels all scientific opinion through to the ministers to make decisions, whether that has had enough experts from outside this core. Perhaps they were guilty of groupthink, and that's why they got stuck on some issues. They thought it was much like flu. They didn't bring in testing. They ignored PPE. They ignored the care home issue and just focused on what they were the key issues. Listen to scientists outside that group, and the alarm bells were ringing for them. And yet the SAGE committee didn't seem to channel the right advice through to ministers, and I think there are big questions over whether ministers acted fast enough on some of that scientific advice.
And Beth, in terms of that relationship between the politicians and the scientists, the wheels came off the bus, so to speak, didn't they, with the Dominic Cummings incident?
His decision to travel all that way to Durham with his family and then controversially visit Barnard Castle. He said he was testing his eyesight. Clearly, Jonathan Van Tam wasn't very happy with that, and he made that statement at that press conference, and he didn't appear at one of those press conferences again. But I think, actually, for me, the most interesting moment between the Prime Minister and his advisors was actually last Friday, when the Prime Minister announced a significant easing of restrictions and then talked about how come November we might be even able to stop social distancing. By Christmas we might be living in a new normal where we're almost back to normal life. And that clearly is in contradiction to what both Sir Patrick and Chris Whitty, Professor Whitty, have said on the record in recent days about what they think. And Boris Johnson, I asked him about that. He's very clear. He said at the beginning of March he followed the science. He then moved to being guided by the science. And then last week he said we take or listen to scientific advice, but as ministers we make the decisions.
Now let's move on to our next subject. As well as the health implications, the country has also taken a massive economic hit, of course, due to COVID-19. So the fourth area we're discussing is Rishi to the rescue.
For the first time in our history, the government is going to step in and help to pay people's wages.
It's pretty extraordinary, to be honest with you. They're talking about the economy contracting by 35%. That's not me misspeaking, that's not a typo, 35%.
It's unique in modern times. We've never seen anything like this.
The UK is facing a significant recession.
Well, Ed, saw you there. I mean, have you run out of historical comparisons? I mean, I'm quite serious. The Great Depression, 1700, and what, the Ice Age, who knows what, the age of the dinosaurs. I mean, it's just unprecedented.
And when we look back at this period, you know, I'm kind of into charts a little bit. When we look at those, you know, those charts, you won't be able to look at any chart of pretty much any economic measure you know, without seeing this enormous cratering fall in the case of most of them, you know, enormous rise in the case of unemployment, one fears in the coming months. This has been a period, you know, the likes of which we have never seen in economic terms. What's striking, though, and, you know, we saw Rishi Sunak, the Chancellor there, is that whereas it's very easy to make criticisms about what many other parts of government were doing, you know, in the kind of face of this pandemic, the one bit which most people think has done a pretty good job is the Treasury stepping into, you know, with the furlough scheme, 9 and a bit million people on that, doing it very quickly, breaking all the rules. And let's not forget, you know, this is a Conservative government introducing a policy whereby the state will pay the wages. These are things which the Treasury never imagined it would have had to have done, but it actually did them very quickly. And, you know, when that inquiry comes, the assumption is the Treasury will come out of it relatively well.
But how much longer can it go on for? A lot of those jobs are now zombie jobs. We're seeing it particularly in the hospitality industry, those bits that have reopened. Well, part empty, and that's even with not very many of them open.
And make no mistake that, you know, the Treasury and the Chancellor are well aware that that was the easy stuff. When the furlough scheme is eased off, as is starting to happen in the coming months, people will lose their jobs and companies, unfortunately, will go to the wall because, as you say, some sectors won't necessarily be able to function in this new existence. Some companies will have struggled already.
Well, you've teed it up nicely for our next sections, Ed. Thank you very much indeed. The race to develop a COVID-19 vaccine took a significant leap forward on Monday. Scientists in Oxford said their first phase of human trials showed that doses were safe and induced an immune response to the infection. So what next for COVID-19?
The UK is not just developing world-leading vaccines, we're also putting more money into the global work for a vaccine than any other country.
I think that the World Health Organization should be ashamed of themselves because they're like the public relations agency for China.
We're absolutely confident that the Russian intelligence agencies were engaged in a cyber attack on research and development efforts and organisations in this country and internationally.
Well, next for COVID-19, Thomas Moore, will there be an effective vaccine?
Yes. I think that everything is pointing towards a vaccine that will happen at some stage. I don't think there will be what they call a sterilising vaccine. That's one that gives 100% protection straight away. But everything points to a vaccine that can take the edge off symptoms with something following behind that does some kind of long-term protection. I think that scientists are increasingly optimistic.
OK, I liked your direct answer to will we have one. What about when will we have one?
That's a much more difficult question to answer. If you speak to Oxford, the team there, Sarah Gilbert, is extremely bullish about being able to produce a vaccine perhaps at the end of this year. And we're talking about the first doses there, Dermot. We're not talking about everybody being protected. If you speak to others, Robin Shattuck at Imperial, he's much more cautious. He doesn't think that we'll have one until at least well into next year. And I think that is a key difference because it's an economic cost. The longer we're living in some kind of restriction, the greater the cost to the economy and indeed health in general.
Thank you all very much indeed. Beth Rigby, Roland Manthorpe, Lisa Holland, Thomas Moore, Ed Conway. Thank you all very much indeed.